Hello and welcome to For Your Health. I'm Mark Crosby. Thank you so much for joining me in the studio. Today we will be talking about smoking, specifically pregnancy and smoking. And to help me out with this topic, we have Christine Kosha, who is the tobacco treatment specialist in the city of Quincy. So Christine, welcome back to QATV.
Thank you, Mark. Thank you for having me back.
Absolutely. You had come in prior, and we kind of did an overview of your specialty.
Yes.
Now we're going to kind of break it down with subsequent episodes and really focus on various aspects of smoking. And I thought pregnancy and smoking would be a good start, and you agreed.
Absolutely. Absolutely. Of course, we know that smoking is dangerous for anyone. But for expectant moms, it's especially dangerous because you're dealing not only with your health, but the health of your unborn baby too. So we try to encourage anybody who's an expectant mom who's smoking to quit as soon as they possibly can. Of course, it's ideal if they quit before they're pregnant, but anytime that they can quit during their pregnancy is also a big help.
And for folks in the city of Quincy that are looking to quit, certainly they should get in touch with you and your department, which is within the Quincy Health Department.
Yes.
If folks are watching this beyond the city limits, certainly they should get in touch with their local health department.
I know that every health department is different as far as offering smoking cessation services. I always say we're very unique here in Quincy because we do offer a service. I know that Mayor Koch saw the value in it. He believed in it, so that's why it was something that we started to offer through the health department, and we've gotten a great response over the last year or so. But that certainly doesn't mean that we wouldn't help somebody from outside of Quincy if they needed the assistance. But I would suggest to people they first contact their health departments to see if they offer something. And there's also, I know we talked about before, but there is the 1-800-QUIT-NOW, which is the state quit smoking line.
Very good. Well, let's get into the topic. So let's look at smoking before and during pregnancy, equally problematic.
It is very difficult. It can be a dangerous thing for any expectant mother, as I say. You need to keep in mind that everything that you do is going to affect your unborn child as well. So all of the decisions that you make for your health are going to affect their health as well. So I know we always have to keep in mind, first and foremost, that smoking is an addiction. It's not easy to give up. If it were, everyone would be doing it and there wouldn't be any problems at all. But I think in a situation like being an expectant mom or knowing that you want to get pregnant, it really is something that you should think about doing first. It's just the dangers involved that affect your unborn child are just numerous, which we're going to talk about.
Sure, let's get into some of the complications.
Sure. Well, the first thing that you would want to look at as an expectant mom is the pregnancy complications in themselves. When a pregnant mom continues to smoke, they have an increased risk of bleeding when they're delivering their child. There could be membranes that become ruptured, things like that. There is a greater chance of stillbirth for a mom that smokes. There is things like poor fetal growth and birth weight. A lot of babies that are born to pregnant mothers can be born premature, or they can just be born at a very low birth rate, and that can lead to lifelong problems for kids as they're getting older.
And developmental problems within the child. Let's talk lungs.
Yes, absolutely. There are other things. The nicotine in itself can have a number of problems, can cause a number of problems for an unborn baby. But nicotine can also sort of stunt the growth of a child when they're developing their brain, their lungs, things like that. So again, those are things that can continue after a baby is born and into their infant years, or just as they start to grow older. It's important during that time to make sure that especially taking care of your health, because you want to make sure, as I keep saying, that your unborn child is healthy, and every mother will tell you that their top priority is to keep their children safe and healthy, and that should start when you're carrying that child as well. So there is that risk of nicotine being in the system. It's going to affect the child, so they could certainly be born with a whole host of different health problems.
As I was looking at the birth defects, cleft lip is one of those that can be attributed, has been attributed to smoking.
Yes, absolutely. As I mentioned, lung development, brain development are usually the top two things associated with nicotine. But then there are other things, the low birth rate that we talked about. There is things like when a child is born to a mother that smoked, there are also those risks of being born with things like a cleft lip, cleft palate, cross-eye. Sometimes you'll see a child that has a sort of a turned eye. That's something else that could be caused from a mother that has smoked. So those are just a couple of things. And there are a number of different problems that can happen for a child after they're born when they've been exposed to that nicotine when they're in the womb. So.
And I didn't realize this, but SIDS, which is sudden infant death syndrome, also attributed to smoking.
Absolutely, yep. There is another greater risk for moms who smoke during their pregnancy for SIDS to develop for their child after they're born. So the stillbirth, and then SIDS is also one of the things that can happen after the child is born. So yes, there's a lot.
The other thing, I suppose, as a parent, you should want to be around for your child to grow up too. So not only are you affecting negatively your child, but you're affecting yourself and the possibility of being around to see that child grow.
Absolutely. I think, as I say, we have to look at smoking as an addiction, which is what it is, and it's a very difficult thing to stop doing. You need to be determined, you have to be committed, and when you make that decision that you want to quit, you have to really be involved completely, 100%. So everyone is different when they get to that point. But I would say for anybody who's expecting a child, that would be at the very top of your list as reasons for wanting to quit. And as you say, you want to be around for your child, you want to be healthy for your child, you want to be able to play with them and run after them and be involved with activities that they're involved in. And so all of that takes energy.
Absolutely does.
When you're a smoker, it kind of slows you down a bit. So, of course, as you say, it's not just for their health, which is always top priority, but for yourself as well.
And I do want to bring up e-cigarettes and all of this because parents may think they're choosing alternatives that are in fact safer, but that's a misconception.
It really is, and I like to always make sure we talk a little bit about e-cigarettes every time, because I think people are still under the impression that e-cigarettes are safer than regular cigarettes. And while it is true that there aren't as many chemicals found in e-cigarettes, there are still chemicals that are in there that can pose a danger to people's health. Especially for women who smoke. Sometimes they have that impression, just like most people, that it might be better for them to switch to e-cigarettes while they're pregnant. And the fact is, there's still the risk of the things that can happen to your child. Just all of that smoke. And because we still don't know a whole lot about what's inside e-cigarettes, they're all very different as to the ingredients and things like that. But anything that you're taking into your lungs and into your system is going to have an effect on your unborn child. Again, with their brain development, their lung development. So all of those things are affected no matter what you're smoking.
And there is a list that I'd like to go through for folks regarding chemicals found in e-cigarettes.
Yes, absolutely. So this is just a partial list of some of the things that are found in e-cigarettes. And as I mentioned, there's over 7,000 chemicals that are found in regular cigarettes. So there's a number of things.
7,000.
7,000. A lot of those are cancer-causing. Others are not. But everything that they put in there is designed to get people more addicted. So this list is just a partial list of some of the things that are found in e-cigarettes. So we have things like the nicotine, of course, which is found in anything that you're smoking. This propylene glycol, which is a common additive in food. It's used to make things like paint solvent, antifreeze, that sort of stuff.
Yikes.
We have different types of carcinogens, formaldehyde, and I think if most people aren't familiar, formaldehyde is used to preserve bodies, things like that. There's this diacetyl, which is on the list, is another one. This is a chemical that was used for many, many years in popcorn factories. It's a chemical, it's a butter-flavored chemical. And they were finding that people who worked in these popcorn factories were getting these lung diseases, which was all being caused by this diacetyl. So it's another thing that is sometimes found in e-cigarettes. The other term for what was happening with these people is popcorn lung. So you may hear that term. That's where that came from. So heavy metals, there's nickel, there's tin, there's lead, traces of those things. We have cadmium, which is something that's it's another toxic metal that's found in cigarettes, and it can cause breathing problems. Benzene, again, this is something that's found in car exhaust. And there's just a number of things on this list. We can go on and on and on. And what I would sometimes tell people to do is, if you walked around your own home and just picked up products that you have, cleaning products, bug sprays, nail polish remover, things like that, there are small traces of chemicals in those things, in those products, that are found in cigarette and e-cigarette smoke.
And I guess this goes without saying, but we'll say it anyway, that these particles are ultra fine.
Yes.
That can be inhaled. I mean, it's not something that you're going to see.
Absolutely. And again, if you look at it in those terms, you wouldn't take any one of these products if you found it under your sink and take it and breathe it in or drink it. We are talking about very small traces of these chemicals, but over time, they're going to cause a significant amount of damage to your lungs. And so, again, as I remind people, nicotine is the addictive substance when you're smoking. It's all these other chemicals that cause the health issues. So over time of taking these in, it's likely that you'll develop some sort of problem.
Right. Yeah, I guess I'm thinking that if someone were to pick up a package of e-cigarettes and read the ingredients, and they said car exhaust, and they said weed killer.
Exactly.
You would think twice, but a lot of times, well, you must have heard the expression that if you can't say the word, most of the time it's probably not a good thing to have in anything you're ingesting.
Right.
So I think sometimes some of these names, the threat is buried in there.
Exactly. Yeah, I don't think a lot of times people associate where these chemicals are, the other places that you'd be able to find them. So that's why, I remember years ago, I worked with a woman who, her husband happened to be a science teacher. So she had access to a lot of these things. So we would do health fairs and school presentations and things like that. And she was able to put a lot of these things out so the kids could see them. And it really was quite an eye-opener, because you'd pick up a small bottle of formaldehyde, and she'd be able to tell them exactly what it's used for, all of these traces of metals. So you really don't often connect it until you see some of the other products that that these things can be found in. And sometimes that's why people look at it and don't really think twice.
And you and I were talking about vaping too, and how that has become popular, I suppose. And folks may vape thinking they're doing less damage or not doing any damage at all to their health.
Right. I think it's been the thinking for a long time now that vaping is safer than cigarette smoking. And as we've talked about, yes, there are less chemicals in e-cigarettes and vapes than you would find in traditional cigarettes, but they're still there. The jury is sort of still out on the dangers of vaping, and I think over time we're going to see more and more come out about the damage that is being caused by people who vape, especially people who do it on a regular basis. You have people who sometimes increase the amount of vaping that they do. They may start out occasionally vaping and then they increase, and that can really cause some serious, and we've seen some serious lung issues happen with a lot of younger people that have been vaping to excess.
So what, if someone were to approach you, let's say either a mother or a pregnant woman who will soon be a mother, asking you what she could do maybe and not smoke, like alternatives that are healthy, but if somebody has to have that oral fixation, I guess, or something to have in place of a cigarette or an e-cigarette, what would you suggest?
Well, there are a number of things. What we like to put together for people, we call their quit plan. And their quit plan involves a number of things. Their quit plan will involve their quit day, what day they decide they want to quit, how they want to go about quitting, if they choose to use any sort of nicotine replacement therapy, getting familiar with what their triggers are, the times of day that would be more likely they'd have a craving to want to smoke, that sort of thing. And also involved in that quit plan is coming up with things, sort of alternatives. One of the best things for cigarette cravings or cravings in general when you're trying to quit is cinnamon. So I tell people all the time, after you've picked your quit day and you're going through the days and weeks after you've quit, picking up some cinnamon is excellent. If you chew gum, you get some Dentyne or Big Red, something like that, cinnamon Altoids, Tic Tacs, whatever it might be that you would prefer, and just keep that with you. But for whatever reason, cinnamon is excellent. It really helps to get the craving to pass quicker.
Interesting.
Yeah, so if it's not cinnamon, it could be any sort of mints. So you want to make sure that you have those things available and ready for, like you say, on those days that you feel like the craving's coming in. For everyone, expectant moms or anybody in general who's trying to quit, you're going to have those times a day when you've always been used to smoking, and that's part of the mental addiction. You have the physical addiction where you're really addicted to the nicotine, and then you have the mental piece, which is all of those things that trigger you to want to smoke, the times of day that you're used to smoking, the routine that you had as a smoker. So you definitely need to come up with things to fill in those times, and you need to fill them in with healthier things. You're sort of replacing a negative habit with a positive one. So those are all the things.
As we get into the next topic, my thought is it's secondhand smoke. So if you're trying to quit, number one, how difficult is it to, I suppose, survive circumstances where you are around other people that are smoking? Does that trigger you if you're trying to quit to simply take a step back?
It certainly can be a difficulty for anybody who's trying to quit. When you're trying to give up something and you have someone around you doing the very thing that you're trying to stop doing, it definitely is always a reminder to you. I've had a number of people over the years that have been in situations like that. Sometimes you need to maybe talk to the person that you're living with and ask them if they might be willing to compromise, maybe go outside, or maybe limit their smoking to one room, that sort of thing. But being around that secondhand smoke is a danger for anybody who's trying to quit. And again, it's difficult for you to keep your focus when you have someone around you doing it.
So, right, not only is it tempting, I suppose, but secondhand smoke in and of itself out there in the air is a danger
Absolutely.
for folks to breathe in. And maybe you could talk a little bit about that.
Absolutely.
It used to be years ago not considered a threat, but it is. I mean, clean air is so important.
It really isn't. I don't think secondhand smoke was thought of, as you say, for a long, long time. And then it's sort of started to become more, we had more awareness about it and how it was affecting people, especially children. The other term for secondhand smoke is environmental tobacco smoke. So this would be the smoke that you're around when you have somebody smoking near you. There is something that's very similar that we call third-hand smoke now, which is the smoke that, if you have somebody smoking indoors, it's a smoke that ends up in the upholstery, in furniture, on the drapes, carpeting, things like that. So all of that smoke is very dangerous to be around. Children are more susceptible. They have issues that can come up like ear infections. There's still that risk for a newborn baby of lung function and brain development when they're around secondhand smoke, the same way there would be if they were, you had a pregnant mom who was smoking while she was pregnant. So there are a number of things that happen when a person is around secondhand smoke as well, and it is dangerous. You just need to really talk to whoever is that's smoking near you or in the house and see if they might be willing. It's for the health and safety of everyone in the home, really. So you want to make sure that you're not around that, because it can cause quite, a lot of people aren't aware that it can cause just as much danger as somebody who's smoking.
I suppose a sidebar, talk about marijuana, because that has become popular. It is now legal in Massachusetts. So I suppose comparing the two, how would you compare the two?
Well, we have definitely seen an increase in marijuana. I think we've all sort of seen that. And as it's become more sort of normalized and it's become legalized, we're kind of learning as we go along that there are some dangers that are involved with marijuana smoking as well. There has always been a link to marijuana smoking and mental illness, schizophrenia, things of that nature. Now we're seeing some stories about people who are heavy marijuana smokers that are developing heart issues. Or we're seeing some people with having heart attacks that smoke marijuana pretty regularly. So there's I think, similar to the vaping and the e-cigarettes, as time goes on, we'll probably see more health issues associated with marijuana smoking. At the same time, we understand that there are people that believe marijuana is helpful for different health problems that they have, which certainly is the case. But as I said, I think we're going to see more about that as time goes on, and just exactly what the health effects are for somebody who's doing it on a regular basis.
You know, something we didn't address with smoking, and I don't know if this would be true with marijuana use, but, and I guess with marijuana too, and with cigarettes, the additional chemicals that are in there maybe weren't in there years ago or now being added. Clearly that's a concern. Absolutely.
People need to be aware with anything that you're smoking, those chemicals are in there to not only get people more addicted, but it helps to, if you say smoke regular cigarettes, it helps to keep the paper from burning faster. So all of those chemicals kind of help the cigarette to sort of stay lit longer. So, you know, you have to kind of think about that when you're smoking anything that you smoke. There are always chemicals that are in there that are never going to be good for anybody to take into their system.
What would you say about fertility? I mean, is that a real issue for someone that would be smoking? The ability to get pregnant in the first place, is it more difficult for smokers?
Absolutely. There is a difficulty for anyone who's thinking about getting pregnant if they continue to smoke. They may have difficulties there. Yes, for sure. So if you are truly committed to wanting to become a mom, you really need to think twice and think long and hard about your addiction to smoking. And I think most women, if they really want to become mothers, they will do all they can to try and quit before they get pregnant. And if you find that it's difficult to quit completely, as I say, any time during your pregnancy is always going to be a help. And even if you end up just cutting back, everything is a victory, and it's going to help your unborn child.
You and I should do a show on education for children and how to educate kids from a young age that it's a danger, and maybe that's something we can do along the way or further down the road. But I guess there was a question in there. Oh, yes. You had mentioned third-hand smoke, and
Yes.
that is a relatively recent term, right?
It is. It's fairly recent now. We have the secondhand, and now the third-hand smoke is becoming more popular. It's something we like to make people aware of, and that again is basically the smoke that just accumulates if you're somebody who smokes inside your house or inside your car even.
Well, often when folks, if they buy a used car and there was a smoker that owned that car, it's very, very, very difficult to get
Yes.
that smell out of there. That's because it's absorbed into the
Absolutely.
car itself, into the fabric.
Absolutely. Any kind of fabrics that you have in your home, your upholstery on your furniture, your drapes and curtains, if you do have carpeting in your house, really anything that you have out all the time, if you're constantly smoking, you're going to have that film and that smoke start to just sort of settle on anything that you have. You know, sometimes I think we've all seen, you know, you'll pass by a car and you can tell that the person's a smoker because you can see a film on the windows, and so I know I always pick up on that pretty quickly when I see it. And you know, sometimes you have to think, if this is the type of thing that you see in your house, in your car, you can only imagine what's happening inside your body, what's sort of settling in your lungs, and the damages that are being caused. So it's truly an eye-opener, and a lot of times when people quit smoking, one of the suggestions that you'll give to them is maybe doing some spring cleaning, giving the house a nice clean, and people always come back and they're amazed at what they find when they're cleaning the walls and cleaning the windows, just that brown film that they see, and that's just over years and years of being a smoker.
Are those chemicals that have been deposited, I suppose?
Yes, absolutely.
So then you have let's say a newborn crawling on the carpet, and you know, they
Exactly.
put everything in their mouths, right? So
Right.
that's a concern too. That there's chemicals that again are linked to cigarettes that you don't want a child that you don't want a child to be touching, to be, you know, whatever children do, licking, you know, right?
Right.
Absolutely, right?
Right. When they're exposed to things like that, as I mentioned, it's not just when a mother is expecting their child, but after the child is born. If you have somebody who's smoking in the home, they are exposed to those things on a daily basis. You know, even if they're, you know, they have a room with their crib and all of their things, that smoke is getting everywhere in the house. So if you're smoking inside, it's going to settle on everything, as I mentioned. So your child is bringing that in, and you're at such a critical stage as infants. Everything is developing. We know that the brain itself continues to develop up until the age of about 27. So it's always developing, for young ones into their teen years, when they become young adults. So that's a very dangerous thing to do. You really want to make sure, as I say, you want to keep everything as healthy as you can for your children.
Just going back to one of the things you said early on is I suppose the weight of a child, or the weight of your child can be affected by smoking. So often I want to say a relative of mine who had smoked during pregnancy had a lot of the children that she had were on the smaller side. Could be attributed to smoking.
Absolutely. Low birth weight is a very common thing for moms who smoke during their pregnancy. Any child that's born before 37 weeks would be considered premature. And with those children being at such a small weight when they're born, they're more susceptible to health problems. So they may develop other problems going forward if they've been exposed to that, and if they were born too early.
Yeah, not a good way to start. So if the parents can get rid of this bad habit early on, certainly everyone benefits.
Absolutely. As I say, I think the most important thing you can do for your child is, to try and quit as soon as you possibly can. And you just want to make sure that your child's, and of course, as I say, every mother will tell you that their child's health and well-being is number one for any mother that you speak to. So that shouldn't just start after your baby is born. It should start, while you're carrying that child.
A lot of times, though, yes, women will say that, will think that, but not realize that they're doing damage before the child is actually born.
Right.
Maybe if they thought that way prior to giving birth, that might change.
There certainly could be that thinking out there. Yeah, they may think, I'll quit once I have my baby, that sort of thing. But it really isn't the case at all. I mean, from the day that you discover you're pregnant, you really should be, and even better, before you even think about getting pregnant, you should really consider quitting smoking and just get that out of the way. The healthier you are, the healthier your child will be.
That would be a perfect reason to stop, to pick a date and stop, certainly.
Absolutely.
And enter another phase of your life, right? As we close, I do want to give out some contact information. This is related to the city of Quincy, but I do encourage folks beyond the city limits to certainly seek out their health department for similar help, I assume.
Absolutely. Anyone in the city of Quincy is more than welcome to contact us. My number at the health department is 617-376-1233. I'm happy to speak with anybody who's thinking about quitting. As far as anyone outside of the city of Quincy, I'm happy to speak with anybody, really, if they'd like to talk and if they need some support. But we have the state Smokers Quit line, the 1-800-QUIT-NOW, which is an excellent resource. They can give you they have counseling online, so telephone counseling, I should say. So you have people you can speak to, or they can certainly give you an idea of what's close to you or nearby if your health department doesn't offer it specifically.
Very good. I want to thank you for coming in, and a very important topic, well covered, and certainly thank you for your time.
Thank you. Thank you for having me, Mark.
Absolutely. And we'll do more shows in the future. And thank you at home for watching, and just remember to support the local access station in the community in which you reside. Take care.